And if you're experiencing knee pain, then this video is for you, because today I'm going to share with you my signature set of exercises and stretches that you can do if you're experiencing achy knees, creaky knees, popping, or just general knee pain. My name is Jenna. I am a movement and pain specialist, and I'm excited to share what I've learned over the last 20 years working with clients who have been struggling with knee pain. So the number one most common myth about knee pain is that you just have to live with it. You're just getting older, your knees are just going to hurt no matter what, and there's nothing you can do. And I'm here to tell you that that's not true. There's actually some really powerful and easy things that you can do that don't take forever, that just require a couple minutes a day to stretch and strengthen, that will really help you out so that you can experience less pain and get back to doing the things that you love to do. So let's get started. The props that you're going to want to use today are a ball and a TheraBand. If you don't have these today, that's fine. You can still do the video. You could use a pillow instead of a ball. And if you have another type of band laying around, it doesn't have to be a loop like this. It could be a TheraBand, then you can grab that. Or you can tie a belt or anything really to use around your legs. I will also link in the description below where you can find these two props. So let's talk a little bit about the anatomy of the knees and why you may be experiencing knee pain. I'm not going to go into the various orthopedic conditions that may be causing your pain, but honestly it doesn't really matter, because when most people do these exercises and stretches, they feel better. Because most commonly what people are dealing with, unless you've had like a tear in the meniscus or in one of the ligaments of your knee, which can take a little longer to heal, you may be experiencing arthritis in the knees, and that's pretty common. But the good news about that is when we move the joint, then we're producing more synovial fluid. When we lubricate that joint by getting that synovial fluid pumping through that joint, then that will help you to feel better, and it will also help your knees to build more cartilage. And that's why movement is so important when it comes to knee pain. But we want to be doing the appropriate movement, the right movement for you, so that you're not experiencing more pain and doing yourself more harm than good. So another reason why you may be experiencing knee pain is your quads, which are the muscles in the front of the leg, may be tight, and your glutes might be weak. That's a very common pattern, especially if you sit a lot throughout the day. That can also shorten the hip flexors, shorten and tighten the psoas, which is another hip flexor, and can lead to wear and tear in that knee joint. Also, your calves could be really tight. I've almost never worked with a client who didn't have tight calves, so most likely they are. So if your calves are tight and your quads are tight, those two muscles are basically going to be doing like a push-pull on your knee joint and literally pulling your knee joint apart. I will put a picture up here that kind of shows what those muscles look like, where they're located, so you can get a better understanding of how this would be relating to your knees. But if we stretch the quads, stretch the calves, strengthen the glutes and the hips, well, that's the perfect recipe for healthy knees. So we're going to get started with that by coming down onto the mat. So we're going to come down using this, it's called a Gertie ball, and I will link it below. You can use any toy ball that's about the same size. It's 9 inches. Or you can use a pillow if you don't have one of these around. And we're also going to use some type of TheraBand. This one's already in a loop. Otherwise, you would take it and you would be tying it around your legs. And I also have some kind of pad that I want to put later on under my knees And if you don't have a nice cushy pad, then you can go ahead and fold up your yoga mat. And I will explain that a little bit more later on. So let's go ahead and come down onto our mat first using the ball. So you're going to take the ball and place it between the knees, and we're going to do what's called adductor squeezes. That's just where we squeeze and release the ball. This is strengthening the adductors, which go down and attach to the knee. So important muscles to strengthen to help stabilize the knee, because the knee wants a certain degree of mobility, a certain degree of stability. Everyone's going to need something a little different. So we're going to address all of those aspects of knee health in today's video. So we want to do about 20 of these squeezes. You can even place your hands on your inner thighs and make sure that you feel those muscles working. So now we're going to take this into a bridge. I'm going to have my arms heavy at my sides. My heels will be lined up with my sitting bones. I want to take a deep breath in. I'll slowly reach my tailbone up towards the ceiling. I'm making my way up into a shoulder bridge, so all my weight's on my shoulders. I take a deep breath in at the top, and as I exhale, I'm going to slowly roll down one vertebrae at a time. If that doesn't feel good doing it that way on your back, most people like the way that feels because it helps to stretch and mobilize the back. Otherwise, you can do a more neutral bridge, which would just be lifting your hips straight up to the ceiling and then hinging down. So whichever one feels better for you, we're going to go up and down 10 times as we squeeze into this ball. Okay, so we also want to be compassionate to our bodies. If we're experiencing any pain, then that's the body trying to tell us, I don't like to do that movement. I'm not ready for that, or that's not right for me, or something's out of alignment. So if you're feeling pain, go ahead and omit that one and use it as an assessment to see, after I do some of these other exercises, can I come back to that one where I was feeling that pain? Now, if you're starting to feel some hamstring cramping, that usually means that the hamstrings are weak and yet they're wanting to dominate and take over the movement, because also the glutes aren't doing their job either. So we want to try to get the hamstrings and the glutes working together. The glutes are the primary hip extensors. So we want to try to squeeze those glutes at the top, feel them working, and then if they're still cramping, you can come down and take a break. Otherwise, we're going to stay up in the position, squeeze the glutes at the top, feel them working, and you're going to squeeze and release that ball just like we did earlier. You can also feel your core engaged. Feel those muscles wrapping front to back and cinching into your waistline. We're going to do 10 of these squeezes like this, and then we're going to go ahead and roll or lower back down. Very nice. So we're going to stretch that out now. I'm going to go ahead and grab my strap. You could also use a yoga strap for this. I'm going to place it around my foot and pull down on the balls of my toes, so I'm stretching my hamstrings and my calves here at the same time. I'm reaching my heel up to the ceiling so that I really feel that length through the back of my leg. I want to open up the back of my knee, because again, if I'm sitting or if I'm in the same position throughout the day, my knee is going to be flexed like this, and we want to create more space there in the back of the knee. Open that up, stretch those muscles there that might be pulling on the knee joint and causing some uneven wear and tear in that joint. I'm going to go ahead and now take this into an IT band stretch. So I'm stretching the muscles down the side of the leg, and a lot of people feel this one in the back of the knee, which means that it's stretching that lateral hamstring that can also be often really tight. And then from there, we're going to go ahead and take it to the other side, keeping the opposite hip heavy on the mat, so that now I'm stretching my adductors. Taking a couple breaths like this and slowly coming back up. Okay, and we'll go ahead and take that foot out of the band, put your other foot in, and switch sides, pulling down
on the balls of the toes. So I'm really flexing at the ankle. I'm opening up through the back of the leg, the back of the knee, creating more space and length, especially in the fascia that could be shortened from keeping the knee in one position throughout the day. Then we're gonna go ahead and cross it over, lengthening the IT band, and see where you feel the best stretch. Some people want to take it all the way over this way, but that becomes more of a spinal twist. So what I usually suggest is keeping your hip down. That's gonna kind of pin one side of the muscle down as you take the leg the other way. Good. Let's do that adductor stretch. I like to place my hand on my opposite hip just to feel what my pelvis is doing, trying to keep that weight mostly in that hip there. Very good. Go ahead and slowly bring that leg back up, take the band away. And now we're going to do some more mobility work for the knee to also help to lubricate that knee joint. So I'm going to slowly bend my knee and straighten my leg. Bend my knee. This helps to pump the fluid through the knee, that synovial fluid that I mentioned earlier, which can help lubricate the joint. It can also help to regenerate the joint by helping your knee to, by allowing your knee to build more cartilage. So if you already have some cartilage there, you can rebuild more. If you're bone on bone, that can be more challenging to do. But if you do have some cartilage left in your knee, you can regenerate, you can rebuild more cartilage. This helps to do that. So now I'm going to keep my legs straight. I'm going to push my thigh into my hands, feel my hamstring contracting, and then I'm going to relax. This is called muscular energy technique. So again, I'm going to just push into my hands, feel the back of my leg, that muscle there firing, and then I'm going to relax for a few seconds. I'm going to push and contract the hamstring, and then I'm going to relax for a few seconds and soften my knee. One more time, I'm going to contract that hamstring, and then I'm going to soften the knee. Okay, so now we're going to do the quad in a little bit. Because it's a little more challenging to do it in this position, but that is going to come in a moment. Now we're going to do the hamstring. I'm going to push into my hands, fire the muscle down the back of my leg, and relax. Again, push into my hands. You should feel it contracting and firing up, and then relax it. Push into my hands, feel it firing, and then relax. One more time, push, and then relax. So now what we're gonna do is grab the band again, place it around your legs, and roll over onto your side. So we're gonna do clamshells here. Clamshells is where I keep my hips stacked. As I exhale, I'm lifting my knee. As I inhale, I'm lowering it down. And this is helpful because these muscles help to support the knee. They have a lot to do with your gait. So when we have strong glutes, strong hips, that really helps to support and stabilize the knee and reduce the pressure and the strain on our knees. I'm going to move on from here to doing a side leg lift. So you can start with doing about 10 of each and then progress to doing 15 and 20. I like to progress slowly over the course of a couple weeks so that your body gets used to the movement. When I'm doing this side leg lift, I want to make sure that I'm keeping my knee straight. I'm also flexing my foot and reaching out through my heel. Great. Let's go ahead and do that on our other side. So I'm starting with those clamshells, keeping my hips stacked, top hip over bottom hip. So I want to feel my deep hip rotators working. I can bring my fingers to my lower glute, that sitting bone area, and feel those muscles turning on. Make sure I'm working from there, not so much from the hip flexors. Okay, so now I'm going to go ahead and straighten my leg and lower and lift my leg. So on the exhale, I lift. On the inhale, I lower down. I'm also working here to keep my ribs in so that I'm keeping my abdominals engaged as well. So I do about 10 of these, and then I'm going to go ahead and rest. Very good. So now we're going to do a stretch for the piriformis muscle. This is a muscle that, if it's tight and short, could also be exacerbating or contributing to knee pain. So for that one, I'll go ahead and roll over, take the band off. I'm going to cross my left ankle and pull my knees into my chest. Now, if this is hurting your knees, then try these options. If it's still hurting, then go ahead and omit it. So you can try bringing your hands behind your knee so you're not pulling on your knee, and that might feel better. And if it's still hurting, or if this other knee is hurting, then just omit this one. See if you can come back to it later on. Let's go ahead and switch sides. Breathing into those hips. Nice, long, deep breaths. Very good. You could always hold that one longer, but in the interest of time, I'm going to go ahead and move on. And now we're going to go into a kneeling position. So this is where I'm going to grab my knee pad, and this might not be appropriate for everyone, in which case you can also omit this one. If it's painful to come down and put pressure on your knees, then just skip past this portion of the video. So I have one knee down on the pad. The other leg I'm lunging forward. I'm going to go ahead and bring my hands on my hips, draw my ribs in, and slowly shift my hips forward in space until I feel a nice stretch down the front of my hip. This is also a psoas stretch, which is why I have my body in a more upright position. Since the psoas attaches through the diaphragm, being in this position will also help me find a stretch in that upper psoas area. All right, let's go ahead and do that on the other side. And again, if it hurts to be on your knees, then you want to omit this one. And I'll show you another way that you can stretch your quads after we do this hip flexor stretch, and that might be more appropriate for you. So you just want to take some long, deep breaths in this position. All right, very nice. So if you're experiencing pain being down on your knees, to stretch your quads, why don't you try going to a wall and seeing how it feels to grab the top of your foot and gently pull your heel to your bum. So you can stay with that more static stretch if that feels good, but I'm also going to show you an MET that you can do like we did for the hamstring. This is a helpful way to move any inflammation through the body. If there's inflammation or inflammatory process going on in the knee, it can also be really helpful to lengthen the tissues there so that you have more mobility. So the way you would do that is you would start to gently press your foot into your hand and notice how that contracts your quad. That's what you want to feel, is your quad contracting. And then as it relaxes, you're going to gently pull it in towards your pelvis. So again, push, feel the muscle turning on, and then gently draw it closer to your pelvis. And you may feel that it's getting a little closer each time. That means your quad is lengthening slowly, which is great because, like I said before, having tight quads can really contribute to knee pain because it's pulling literally on that joint. So let's go ahead and try that On the other side, you're going to start with stretching, just taking a couple of breaths, drawing the heel towards your pelvis, but you're not forcing it, and especially if you're feeling pain bending your knee, then you wouldn't want to do that. Remember the rule, if you feel pain, omit it and come back to it later on. See if you can do it after doing some of the other strengthening exercises. Now we're going to move into that MET, so I gently push my foot into my hand, and then I pull a little closer towards my pelvis. I do that a few times. Push into my hand, contract the muscle. As I relax, I slowly draw it closer. So we go through a few cycles like that. And again, if you're feeling any pain, that's where you would want to stop, okay? Very good. So the last exercise we're gonna do is using our band again. So go ahead and grab that again. My band and place it around my legs right above my knees. This is a pretty common exercise, so you may have seen this one before. It's called monster walks. So I'm going to go ahead and just start to step laterally out to one side, and then when I just run out of room, I go the other way. So we want to try to keep the spine long. I'll show you from the side view. Notice how I'm not rounding my body. So I'm imagining that I'm showing off my ducktail feathers, keeping my neutral spine, and I'm only bending forward as much as I need to. I'm not doing a major squat here. So if you are experiencing knee pain in this position by bending your knees, here's what I'm going to have you do. Just step side to side, step side to side. So that would be your alternative. Okay, and if that hurts, then again, you may want to omit this exercise. Try some of the other ones. Figure out which ones hurt, which ones don't hurt. Do the ones that don't hurt for a few weeks, and then come back to some of these other exercises. Okay, so if those monster walks are feeling good, then I want you to continue doing those, trying to go for about 5 sets of 5, which means I'm going 5 times to the left, 5 steps to the right. I don't actually think I did 5, but I'm just trying not to run out of the camera's view. But I'm going to do 5 sets of 5, okay? And then I'm going to relax. So try those out and see how they feel. There's one more thing I want to show you to help support, strengthen, and stabilize your knees. And that is to work on firing this muscle called your VMO. I'm going to show you how you can contract and relax that muscle. And this is really helpful if you have your patella tracking laterally, which means when you draw up your kneecap, it's starting to move out to the side. That means the muscles on the outside of your leg, your lateral quad muscles, are tighter. They're pulling your knee kind of over to the side. And instead, we want the kneecap to be able to track straight right up our femur. So the VMO helps to do that. So what I'm going to do is just tap it here, and that is helping to wake that muscle up. So I'm tapping it right here, squeezing my quad, which is drawing up the kneecap. I am tapping this muscle here, waking it up, getting it working. That's helping to track the kneecap straight up and down. And this is just a good muscle firing technique to balance out some of these tight overworking muscles on the side of the leg that are pulling the kneecap in the wrong position, which could be causing some wear and tear on your knees and some pain. And of course, as you already know, everyone's body is so different. So why you're experiencing knee pain, it's really going to depend on a lot of different factors, including your lifestyle habits and including any injuries that you may have experienced in the past or that you might currently have going on. So if you want more support with this, then please reach out to me, and you can find all of those links in the description below. Thanks so much for joining me. I hope this helped, and I will see you in the next video.